So we were actually really lucky with her. When she was first diagnosed with the omphalocele, her stomach, her liver, all of her intestines were in the omphalocele. And what it is the body the organs are growing on the outside, but they kind of form like a really thin skin over that and kind of holds that in, the organs in there. It's kind of the umbilical cord kind of stretches out and all these organs kind of grow up in there. And when she was born, she was really lucky because they were saying she had a giant omphalocele, which they classify either small or giant by how many whole organs are inside. And because she had the stomach and the liver in there, it was a giant omphalocele. By the time she was born, though, the omphalocele had actually compressed down, and so she only had her liver in the omphalocele, the outside. She was able to be closed at 3 days old. They went in and pulled skin up over that and pushed the organs down in and closed that. I know there are a lot of babies that are born with omphaloceles that aren't able to be closed right away, and there's a lot who have the OAIS complex that the omphalocele is just there, the organs are just on the outside, and over time the body will actually grow skin up over that, and then later they'll go in and they'll either do compressions and they'll compress that down in until it can be closed, or some babies they'll do what they call a silo, where they have to pull the organs up to bring the weight off of the baby, and then they'll slowly let gravity pull those organs down in. It kind of depends on the severity of the omphalocele, how long the baby will end up in the NICU, and when they can do surgery on them, and how severely it'll affect them, because sometimes the body isn't big enough for all those organs to be compressed down in, and so when they try to do that, it'll push up on the lungs and cause breathing problems or heart problems or other things because they had been growing without the organs in there for so long. The omphalocele is actually more common. It's about 1 in 2,000 babies that are born with omphaloceles, but the majority of them are able to be closed up pretty soon after birth. I know a lot of doctors, when they see an omphalocele on ultrasound, one of the first things they talk about is termination, because omphaloceles are associated with trisomies that aren't compatible with life, and so that's kind of like one of the things all doctors say is, oh, you're going to have a really small chance of this baby surviving, but from what I have talked to others about the omphaloceles, it's actually a much higher rate of survival in these children, and most of them go on to lead totally normal lives. They get closed up and they're fine. Our daughter's omphalocele, it doesn't really affect her a lot now after it's been closed. She hasn't had any problems with that.